I'm Norah Terrault, and I'm here with Rinella. So you may not know this, but you will very soon. Maru and Phil Newsom were the co-leads on the steering committee that developed a new nomenclature. So let me say thank you for all of the work done. We at ASLD are extremely grateful, but so too are the other global societies, ALE and EASL. So an amazing amount of work done over 3 years, many involved. Very, very exciting to see sort of the fruits of all of that labor come through to be presented today. So I want to let you kind of explain kind of what this means for the physicians that are out there, for the patients that are out there, for the community in terms of understanding what this means.
Thank you. So thank you for the support that ASLD provided and EASL as well. So basically what we did is we used a Delphi method in an attempt to bring together stakeholders that had very different points of view. And so that was the method we used to sort of come as close as we could to a consensus. There were some things that were quite high consensus. One of those was that an overarching term was preferable, and that makes sense because there's a lot that we still don't know about the disease, and this will allow us to expand with upcoming knowledge, and so that was one potential benefit. The other was that it recognizes that there are other causes of steatosis in the liver that are not maseled, or alcohol, for example. One of the most, I think, important things that came out of this process was the identification of a group of patients that wouldn't traditionally be deemed alcohol-related liver disease, but that wasn't strictly considered non-alcohol-related liver disease either. And we felt that because it's a growing number of people and a very relevant population that's not studied in clinical trials right now, that we should have that as a separate category. And that was a very high consensus sort of concept in the above 80% range for that. I think one of the important things to think about is that change is always hard, and I think that no matter how big or even small it is, change is really hard. And I think the way I look at these sort of affirmative diagnostic criteria are really just operationalizing what you would do anyway with your patient. When you saw a patient with what you thought might be non-alcoholic fatty liver disease, you would ask yourself, well, do they have diabetes? Do they have prediabetes? Do they have central obesity? Do they have hypertension? And if the answer to all of those was no, then you would start thinking for other causes of their liver disease. And so all we did is essentially operationalize that. We were very careful to not define a population that wasn't previously defined in natural history studies, in trials that looked at therapeutics and in biomarker development. So there should really be no impact on that. So I guess in a nutshell, that's sort of what we did.
And there will be this resource available on the ASLD website. There's going to be a publication in the journal. So I think there'll be a lot to learn as this comes out. But what we wanted to really do is to help our community get familiar with this new terminology, how to think about it with the patients they're seeing. So we are going to have resources on our website. Right. Everything from coming up with decision trees on how do you assign your patient a specific diagnosis, how do you deal with this new category of MET ALD that you were referring to, where there's this recognition of alcohol use among an individual who has metabolic risk factors. So a lot that I think we're going to want to educate providers on, as well as our patients, and just the larger community. Yeah. Well, this is really an exciting time, but the work just beginning.
It just began. Yeah. There's a lot to do. So looking forward to it.
We'll be engaging you and others that were involved in the process also at the upcoming TLM meeting. As you know, it's just around the corner, really. November comes very quickly, and given that it's really this new period of time and where we really anticipate we'll learn already about how this is taken up by the providers, the patients, the community. This is an opportunity for us to use the meeting for further education and further, bringing it forward. So we'll be using the TLM as another educational opportunity, another way to really socialize this concept to even the community outside of the US, right? We're very kind of US centric, AASLD, but we're also global, and we want to kind of contribute to the growth of this this nomenclature and how it rolls out to the global community. So we really look forward to, of course, having you remain very engaged. You've been such an amazing leader, and we look forward to having you participate in the TLM as well. And I want to just, and I know, Mara, you would agree with this, that, the patient advocacy group, that voice was really important as you thought about the need for new nomenclature. They had an important say, and I think a lot to be given credit to hearing that voice, and really that was an important motivator for a change. We're also hearing from those same communities about sort of some of their, in a way, fears of now having to create educational materials they're on the forefront, and how do they bring this new information to patients.
Right.
So ASLD is really committed to kind of working with them, developing a path to help minimize the impact, as it were, right? To ensure that we're continuing to support them in their activities. That's an important aspect of what ASLD is also doing.
Right, that's critical, right? Because just like we started as a very diverse group of stakeholders, some of us very entrenched in our own thoughts and our feelings about this concept, we moved towards one another. And I think in the patients as well, there was also disagreement. Some people felt one way, others felt other ways, because of course no one person is going to be able to represent all patients. But I think at the end of the day, we came to a good end that has compromise for everybody. And I think it is, and I would agree with you, our responsibility to help guide people through that change, because it's going to feel like a very big change. But I think that it's absolutely doable, and we'll be happy about it. Probably for in a couple of years, we'll be happy about it.
That's right, exactly.
Yeah. So,
well, thank you again. Really, my thanks to you, but also just a very exciting time for the community. Really, I think we're all very excited about this next step. So, looking forward to seeing how we move this forward.
Yes, and thank you very much again for your support. So.